Hi there, I am Dr. Brijesh and today we know more about the hydroxychloroquine and its side effect profile. Hydroxychloroquine is an anti-malarial drug and an immunomodulatory drug used to treat the rheumatoid arthritis, SLE and porphyria cutanea tarda. Recently, because of some initial reports suggesting the effectiveness of the hydroxychloroquine against the COVID-19 virus, we are using and many countries are using hydroxychloroquine in the prevention and the treatment for the COVID-19 infected viral patients. ICMR, the Indian Medical Research Council and the FDA already approved and given the recommendation about the usage of this drug for the prophylaxis to the healthcare workers and the household or the close contacts of the COVID-19 laboratory confirmed cases. According to this, 400 mg tablets should be taken twice a day on the day 1 and followed by the weekly for 7 weeks for the healthcare workers and for 3 weeks to the household of the close contact of the laboratory confirmed COVID-19 virus infection patients. The initial French study on 20 patients declared on the March 16 shows a reductions and the disappearance of the viral loads in COVID-19 virus infected patients. A little later, a little big study, an uncontrolled study on the French patients of 80 patients treated with this drug shows the same results that complements the reductions that complements the previous study and shows reductions and the disappearance of the viral load in the COVID-19 infected patient, but still the death cannot be preventable. So still we are lacking the evidence that really this drug is working against the COVID-19 virus or not. We are still awaiting the more data. We are still awaiting for the larger studies about the confirmation that really this drug is acting against the coronavirus patient or not. But it is very reasonable and it is very practical to take all the precaution before using these drugs as a prophylaxis or the treatment. We are using this drug for the treatment of the patients, for the prophylaxis, for the close contacts of the COVID-19 viral infection patients like the doctors, healthcare staffs and the household contacts and the other close contacts of the infected patients. So basically these drugs is a white tablet that comes in a strength of the 200 or the 400 milligram tablet, and it should be taken with the meal or with the food. This should not be taken on empty stomach because it can cause a gastritis like the nauseating feeling, vomiting and abdominal pain. So always take on with the milk or with the milk. The side effect profile is long and you should always take care of it, like it can cause itching or the skin rashes or sometimes cause the skin pigmentations. On the hair, it may cause the loss of the hair or the change in the hair colors on the long standing use. It may cause nerve deafness or the ear deafness. On the long-term studies, on long-term usage of these drugs can cause the reductions in your eyesight. It can cause color blindness. And usage in the long-term basis can cause depositions in the retina and the cornea. So it is very imperative to check for your visual acuities. It has harmful effects on the blood count too. So it may cause aplastic anemia, reductions in your white cells like leukopenia, or reductions in the platelet count like a thrombocytopenia. Sometimes in diabetic patients it can cause hypoglycemia that turn out to be like a shock and patient may go unconscious. So it causes hypoglycemic shock. As everybody know that this drug also prolong the QT interval. So the person who's already having reduced cardiac reserve, the one already having the decompensated heart failure, the one already having a problem with their heartbeat rhythm and the rate, or the one who already taking this drug along with the other drugs that prolongs the QT interval, they should take precaution because using these drugs cause the ventricular tachycardia or the atrial fibrillation, that could be very dangerous. So other drugs like the azithromycin that is already using in treatment trials of this patient is also prolonging the QT interval. The other drugs like the moxifloxacin, domperidone, antidepressant drugs and antipsychotic drugs. So if you are on such a drugs, then you should ask your doctors how to take these drugs, or whether the drug is suitable to you or it is not suitable for you. So this is the very important thing. One more important thing is the person who already is having an alcoholic liver disease, or the already is having hepatitis. So these drugs raise the liver enzymes and may cause hepatitis. So it should not be taken in these such patients. It may also should not be taken for the renal compromise patients. So this is the side effect profile of the hydroxychloroquine. So practice precautions for specifically this group of the patients, like the alcoholic, like the elderly, like the one who already having the heart failure or the other cardiac problems. So and for the diabetic patients. So these patients should always take precautions and ask the doctors whether this drugs is good for you or not. And they should also periodically check their complete blood count, liver enzymes, and the eye and the renal function test. In some cases, it is contraindicated to take this medication, like it should not be taken in the children less than 15 years of the age, and also it is category C drug in the pregnancy. That means it should be taken only and only if these medications gives more benefit than the side effects. The same story is with the lactating mothers, because these drugs secretes in the breast milk. So ask doctors, take this medication only and only if the benefit is more than the risk involved in taking these medications. These drugs should not be taken the one who already having the allergic reactions to these drugs. And yeah, so knowing all these about the side effects, you can prevent the side effects. You can check out whether the side effects are happening or not, so you can be healthy. Thank you.